Hello. Welcome to the PARS Health Clinic channel. We hope you're happy, healthy, and wealthy. In this channel, we give you tips to keep you healthy and out of trouble. In this video, we want to talk about how to stretch and exercise the wrist to treat the carpal tunnel, and the easiest ways to get rid of wrist pain. This video is for educational purposes only, and if you have any specific condition or illness, you should consult with your doctor. It is no secret that as a society we've become accustomed to doing a lot of writing, texting, and typing in our daily lives. As much as we think that it has little to no effect on us, it can. Constantly putting a strain on both our wrists and hands can lead to carpal tunnel syndrome. Luckily, many different stretches and exercises can be done to help alleviate the pain, as well as prevent future symptoms. If you start feeling symptoms of pain, numbness, or tingling in the hand, wrist, or elbow, try out some stretches. What is a carpal tunnel? The carpal tunnel is a passage between the wrist and the hand that contains tendons, ligaments, blood vessels, nerves, and bones. The median nerve runs through this passage, from the forearm to the hand. The median nerve provides sensation to some of the fingers, including the thumb. Excessive pressure to the wrist can compress the median nerve. This may happen as a result of a wrist injury, repetitive movements, or rheumatoid arthritis. According to the National Institute of Neurological Disorders and Stroke, people with diabetes have a higher risk of carpal tunnel syndrome, and females are 3 times more likely to develop carpal tunnel syndrome than males. Carpal tunnel syndrome affects millions of Americans each year, yet experts aren't entirely sure what causes it. A combination of lifestyle and genetic factors are likely to blame. However, the risk factors are so diverse that nearly everybody has one, or more of them at some point in their lives. Symptoms of carpal tunnel syndrome can include numbness or tingling sensation in the fingers, particularly the index, middle, and ring fingers, and the thumb. Symptoms occurring or worsening at night. Weakness in the hand leading to the loss of grip strength, making holding objects or carrying out everyday tasks more difficult. In severe cases, inability to feel hot or cold temperatures with the hand. Exercises and stretches. There are several exercises and stretches a person can try to help relieve the symptoms of carpal tunnel. People may feel a gentle pull or stretch during the following exercises. However, they should stop if they experience any pain. If you like topics like this, make sure to subscribe to our channel to see daily videos just like this one. Alright, let's get started. 1. Wrist extension. This exercise stretches the muscles in the inner forearm. Hold one arm straight out in front of the body at shoulder height. Try not to lock the elbow when stretching the arm out. Bend the wrist back, as if making a stop sign. Use the other hand to gently pull the palm back toward the body to feel a stretch in the inner forearm. Hold for 15 seconds. Release and repeat 5 times. Repeat the whole exercise on the other arm. People can do this sequence 4 times per day, 5 to 7 days per week. This also works well as a warm-up stretch before activity, especially one that involves gripping. 2. Wrist flexion. This exercise stretches the muscles in the outer forearm. Extend one arm in front of the body at shoulder height. Try not to lock the elbow when stretching the arm out. With the palm facing down, bend the wrist, so the fingers point toward the floor. Using the other hand, gently pull the bent hand toward the body to feel a stretch in the outer forearm. Hold for 15 seconds. Release and repeat 5 times. Repeat the whole exercise on the other arm. People can do this sequence 4 times per day, 5 to 7 days per week. One can also use it as a warm-up stretch before activity, especially any exercise that involves gripping. 3. Median nerve glide. A glide is a stretching exercise to help relieve pressure on a compressed nerve, such as the median nerve. The American Academy of Orthopedic Surgeons recommends that people apply a warm compress to the hand for 15 minutes before doing this stretch. Make a fist with one hand, keeping the thumb on the outside. Uncurl the fingers, stretch the fingers and thumb out straight, and then keep the thumb pressed to the side of the hand. Gently bend the hand back toward the forearm, then extend the thumb out to the side. Using the opposite hand, apply gentle pressure on the thumb to stretch it. For each change of position, hold for 3 to 7 seconds. Release and repeat the whole exercise on the other hand. People can repeat this exercise 10 to 15 times per day, 6 to 7 days per week. Holding a cold compress, such as ice or a bag of frozen peas, on the hand for 20 minutes after the exercise may help prevent inflammation. 4. Tendon glides. This exercise gently stretches the tendons in the carpal tunnel. Some research shows that using a splint alongside the tendon, and doing nerve gliding exercises, improved carpal tunnel syndrome more than using a splint alone. People may want to apply a warm compress for 15 minutes before carrying out these exercises, and a cold compress afterward for 20 minutes to avoid inflammation. People can do these exercises on both hands at the same time, or alternate between each hand. Bend the elbow, so the forearm points straight up. Straighten the fingers and thumb out in line with the wrist, so all fingers are pointing straight up. Bend the top of the fingers to make a hug shape. Then bend the fingers into a tight fist, with the thumb on top of the fingers. Hold each of these positions for 3 seconds. People can also try the following, which is a similar tendon glide exercise. Straighten the fingers and thumb out in line with the wrist, so all fingers are pointing straight up. Bend the fingers from the bottom knuckles, pointing them straight out at a right angle. Bend the fingers from the middle knuckles, so that the fingertips touch the palm. Hold each of these positions for 3 seconds. Repeat these exercises 5 to 10 times, 2 to 3 times per day, for as many days of the week as feels comfortable. 5. Wrist lift. This exercise works the muscles of the forearm. Place one palm flat on a table. Place the other hand directly at right angles across the knuckles. Lift the fingers of the bottom hand while pressing down with the top hand. Repeat with the opposite hand. 6. Hand squeeze. This exercise works the forearm muscles. People will need a soft rubber ball for this exercise, or a pair of rolled up socks. Hold the ball in one hand. Squeeze for 5 seconds and release. Repeat 10 times. Do 3 sets of repetitions and then swap to the other hand. 7. Wrist stretch with weights. This exercise stretches the flexor muscles in the forearm. People will need a light weight for this exercise, such as a can of beans. If it feels comfortable, people can gradually increase to slightly heavier weights. Hold the weight in the hand and extend the arm straight in front, with the palm facing down. Slowly bring the hand up and back toward the arm, bending at the wrist. Slowly return to the starting position. Repeat 10 times for 3 sets. Swap to the other hand and repeat. Hand exercises may help alleviate mild symptoms of carpal tunnel syndrome or help prevent it from developing from repetitive, everyday movements. Doctors can usually treat carpal tunnel fairly easily. People may find that consistently practicing the exercises for 6 to 8 weeks helps relieve symptoms. If hand exercises are not effective in easing symptoms, wearing a splint when symptoms worsen, such as at night, may help. The exercises mentioned in this video should only be part of your treatment plan. Other treatments for carpal tunnel include applying cold packs, taking frequent breaks, splinting your wrist at night, corticosteroid injections. Get a wrist splint and reusable cold packs today. If people have persistent symptoms of carpal tunnel, they may want to seek guidance from a doctor. A doctor may advise other treatments alongside physical therapy. Your doctor may recommend surgery if these treatments don't improve your symptoms. If you are interested in videos like this, make sure to like this video and subscribe to our channel. We hope you have a wonderful day. See you in the next video.